On April 30th, 2024, Walmart delivered a shocking announcement. It was closing all of its health centers and virtual health services. How did a venture with such massive potential, backed by the world's largest retailer, come to such an abrupt end? This video delves into the rise and fall of Walmart Health, uncovering its strategic origins, its growth trajectory, the complex challenges it encountered, and its eventual demise. Walmart's venture into healthcare was not a whimsical decision, but a calculated response to significant deficiencies within the U.S. healthcare system. The company identified profound opportunities to address critical issues plaguing access, affordability, and convenience. Millions of Americans face substantial barriers to receiving basic medical attention. A significant portion of the population lacked a primary care provider, and for those fortunate enough to have one, securing a timely appointment often proved to be an arduous task. This led many individuals to seek care in costly emergency rooms for non-emergency conditions, highlighting a fundamental accessibility problem within the system. Geographic access presented another formidable hurdle. Numerous rural and underserved areas, often termed healthcare deserts, usually have their nearest primary care provider hours away. Simultaneously, a substantial segment of the population either lacked health insurance or was underinsured. The pervasive fear of exorbitant medical bills deterred many uninsured individuals from seeking necessary non-emergency care, forcing them into emergency settings only when pain or discomfort became unbearable. Walmart recognized these as critical accessibility and affordability challenges. Walmart, with its vast network of stores, saw its ubiquitous presence as a unique asset to bridge these gaps. Its core concept involved establishing primary care clinics directly within or adjacent to its supercenters. This strategic placement aimed to meet patients where they already lived and shopped, thereby addressing both accessibility and convenience. The clinics were designed not only to provide care, but also to potentially generate additional foot traffic to the main store, creating a synergistic effect with existing pharmacy and grocery sales. True to its retail heritage, Walmart intended to apply its renowned economies of scale to healthcare. The goal was to provide primary care services at significantly lower and transparent prices, making them affordable, especially for the uninsured who paid out of pocket. Walmart health centers were designed as one-stop shops offering a wide array of services. These included primary and urgent care, labs, x-rays, EKG, counseling, dental, optical, and hearing services. The initial premise of applying Walmart's retail efficiency and scale to healthcare was based on the belief that its mastery of operations and supply chain could disrupt a fragmented and costly industry. The strategic rationale heavily relied on its existing physical presence and brand as a neighborhood destination. The underlying idea was to leverage the high foot traffic of its retail stores to drive patient volume for the clinics, positioning Walmart as the front door of healthcare. This approach implicitly assumed that consumer behavior for healthcare would largely mirror retail behavior, prioritizing convenience and low prices. It also assumed that physical proximity would overcome existing barriers to care and that cross-shopping would create additional revenue streams. Walmart Health embarked on an aggressive expansion, fueled by initial successes and a clear market opportunity. The company steadily grew its physical footprint and strategically integrated virtual care to broaden its reach. Walmart Health launched its very first clinic on September 13, 2019 in Dallas, Georgia, located adjacent to a Walmart supercenter. This pilot aimed to develop a proof of concept and identify any unforeseen issues. Early feedback was overwhelmingly positive. Patients reported high satisfaction, with 96% stating they felt cared for, and over 50% of visits came from returning patients, indicating strong retention. Clinicians also expressed satisfaction with the integrated care model. Walmart noted a clear shift towards chronic care management, suggesting success in preventive care efforts. The company's growth trajectory was rapid and ambitious. By the end of 2020, Walmart Health operated 6 locations, with 5 in Georgia and 1 in Arkansas. By the fall of 2022, Walmart Health had 32 locations across Arkansas, Florida, Georgia, Illinois, and Texas. By April 2024, Walmart Health had 51 locations across 7 states. This aggressive and rapid expansion strategy, aiming to nearly double its clinic footprint and integrating virtual care through acquisition, aligns with typical retail growth models focused on quick market penetration and scale. Recognizing the surge in demand for remote services during the COVID-19 pandemic, Walmart Health strategically acquired the virtual health company MeMD in May 2021. This acquisition was later rebranded to Walmart Health Virtual Care. Walmart Health rolled out its expansion plans during a period of severe healthcare worker shortages, a situation significantly exacerbated by the COVID-19 pandemic. Many healthcare professionals retired or left the profession altogether, intensifying an already strained workforce. To attract and retain the necessary doctors, nurses, and other staff, Walmart Health faced significantly increased labor costs. This incremental spending, coupled with the inherent difficulty of filling clinic positions, directly impacted the profitability of its operations. Furthermore, Walmart Health often located its centers mostly in underserved rural areas where recruiting and retaining clinicians is historically more challenging and expensive, further compounding its workforce problems. Another critical challenge for Walmart Health was the challenging reimbursement environment. Primary care services, particularly under a fee-for-service model, typically have the lowest health insurance reimbursement rates. To achieve profitability, clinics needed to see a very high volume of patients and submit numerous claims. Insurance companies frequently deny claims, and the extensive administrative overhead associated with billing and collections further reduced net revenue. This administrative baloney was precisely what Walmart aimed to avoid with its initial cash pay model, but it ultimately proved unavoidable as the anticipated demand for cash-paying patients did not meet projections. Walmart Health's expansion coincided with a period of sharp and sustained inflation following the pandemic. This economic reality led to rapid increases in the cost of products, services, and construction, making it difficult to accurately project the real cost of expansion and ongoing operations. These volatile and rising costs likely eroded profit margins and made a sustainable path to profitability increasingly elusive. In most health systems, primary care is often a loss leader when it comes to making profits, and it is often used in attracting patients that are then funneled into higher revenue specialty services, hospitalizations, and procedures. This downstream revenue helps offset the lower profitability of primary care itself. Walmart Health, however, was primarily a standalone primary care provider. Without a broader network to connect patients to specialty care and procedures, it missed out on these higher revenue opportunities that typically support primary care as a loss leader in large health systems. The hypothesis that clinics would significantly boost sales of other Walmart products, often referred to as the milk in the back of the store theory, also did not materialize as expected. In addition, the company's innovative pricing model, while appealing to the uninsured, may have also inadvertently created challenges in negotiating higher reimbursement rates from health plans, making it difficult to transition from a super low cash pay model to insurance reimbursable services. The culmination of these challenges led to a sudden and definitive strategic reversal. On April 30th, 2024, Walmart released a shocking announcement. It was closing all of its Walmart Health centers and virtual health services. The decision impacted all 51 health centers across 5 states and the Walmart Health virtual care offering. Walmart stated that the primary reason for this difficult decision was the determination that there is not a sustainable business model for us to continue. Specifically, the company cited the challenging reimbursement environment and escalating operating costs as factors that created a lack of profitability, rendering the care business unsustainable at that time. The official closure date for all Walmart Health locations was June 29, 2024. Walmart Health's journey from an ambitious disruptor to an abrupt closure offers a compelling case study on the complexities of the U.S. healthcare system. The initial rationale, built on leveraging Walmart's unparalleled scale, geographic reach, and commitment to affordability, was a logical extension of its retail success. The rapid expansion of physical clinics and the strategic integration of virtual care demonstrated a genuine commitment to addressing critical gaps in access and cost. However, the venture ultimately succumbed to a confluence of formidable challenges. The persistent healthcare worker shortages and escalating labor costs proved a significant drain on profitability. More fundamentally, the U.S. healthcare reimbursement environment, characterized by low primary care rates and administrative burdens, made it exceedingly difficult to sustain a profitable model, especially when the anticipated volume of cash-paying patients did not materialize. The loss leader strategy, common in integrated health systems, failed to translate effectively without control over higher revenue specialty services. This indicates that simply transplanting a retail business model into healthcare is insufficient. The industry demands a nuanced understanding of its unique financial and operational dynamics to be profitable, which is why disrupting healthcare in the United States is still a big challenge that is yet to be solved. If you enjoy this video, please kindly like it and subscribe to this channel for more videos like this.